Actions are your go-to destination for all documentation not covered in medication, I&O, or vitals. Like most things, you can access these through both the toolbar or the toolbox. To see a complete list of the type of actions available and familiarize yourself with the actions, let's use the toolbar button. This view provides a complete list of every action available. You will see that they are divided into categories: airway management, case setup, case times, emergence, miscellaneous, procedures, and labor and delivery. Unlike accessing actions that have been built in your macros, these are not defaulted with charting selections. By choosing nasal endotracheal tube and then clicking on document, you will see that no fields are highlighted as seen in the examples from your macro. In this example, where an action was not already built into the macro and you add an additional action to document, you will simply go through the fields and click on the appropriate documentation. Note that some fields allow multiple options to be selected, such as technique, while other fields, like laryngoscopic view, can have only one selection. On number of attempts, a keypad becomes available to document the exact number of attempts. Lastly, when you choose Other, a comment box becomes available to enter text as desired related to that field. After selecting all documentation, you again have the option to change the time of the documentation and select OK. Let's navigate back to the Action button on the toolbar. Note that on fields that have been documented, you can click on them and have the option to sign or edit these individual fields or delete the documentation. The details are seen in the pane in the upper right. Lastly, bring your attention to these 4 markers. These are all examples of integration points with the nursing surgeonette record. When anesthesia and nursing are documenting these actions, will populate your record from the nursing documentation. You should not document these fields, and they are not included in your macro. By documenting these fields or changing these times, discrepancies will occur between the records. If you choose to use the toolbox to document actions, you will find that it is easier to initiate the actions if you know their location. The toolbox is recommended for initiating and starting all documentation, but does not allow you to modify or remove current documentation.